After testing positive for a gene mutation that increases the risk of both breast and ovarian cancer, Angelina Jolie made a private decision very public. She underwent a double mastectomy to reduce her risk of the disease. A woman with mutations in the BRCA1 and BRCA2 gene is 5 times more likely to develop breast cancer than a woman without the mutation, and is 28 times more susceptible to ovarian cancer.
You have to make sure people are aware of what makes them more likely and whether they should get tested. They're a candidate for testing without freaking them out that they have to rush down and get a test.
Congresswoman Debbie Wasserman Schultz opted to undergo BRCA gene testing after being diagnosed with breast cancer at age 41. She tested positive and underwent a double mastectomy to reduce her risk of recurrence.
The wonders and the brilliance of the accomplishment of being able to unlock the genetic code gives us the ability to help make sure people can stay healthier longer, make it more likely that we can save people's lives.
That said, only 5 to 10% of women carry this gene, and the cost for testing is about $3,000. I recently spoke with Dr. Mehmet Oz about the issue. He pointed out another concern.
The question is the testing that accurate? And what if the BRCA gene predicted you only had a 5% chance of dying of cancer? It's still significant. What do you do then?
But for those who test positive, most experts agree surgical intervention makes sense.
This makes complete sense because they have such a high likelihood of developing breast cancer in their lifetime, up to an 87% lifetime risk.
Among those who should be considered for BRCA gene testing are young women with a diagnosis of breast cancer, women with a family history of ovarian or breast cancer, and women of Ashkenazi Jewish descent who have some risk factors. With your second opinion, I'm Dr. Ari Soffer.